This episode is brought to you by State Farm. You might say all kinds of stuff when things go wrong, but these are the words you really need to remember. Like a good neighbor, State Farm is there. They've got options to fit your unique insurance needs, meaning you can talk to your agent to choose the coverage you need, have coverage options to protect the things you value most, file a claim right on the State Farm mobile app, and even reach a real person when you need to talk to someone. Like a good neighbor, State Farm is there.
Hello again, I'm Nurse Mo, and this is the Straight A Nursing Podcast where I teach concepts and share tips to help you thrive in nursing school and at the bedside. Today we'll be going through a pharmacology concept, but before we do that, let's take a quick minute for our listener shout out. And this one goes out to Lucy B, who says, I love how the subjects are explained in ways that make sense, are easy to grasp, and remember. Is there a website or anywhere that you could actually read the podcasts or find notes? Well, Lucy, I have fantastic news for you. Yes, most of these episodes, and I would say 98% of them, do have an accompanying blog post or written article on the Straight A Nursing Student website. So anyone who is curious about this, like Lucy was, then all you need to do if you want to get the actual written, basically the transcript of these episodes, is to go to the Straight A Nursing Student website, which is at straightanursingstudent.com, and you can just use the search bar at the top right to find what you're looking for. Alrighty, are you ready to dive into this pharmacology episode? We are talking today about peripheral nerve blocks. So a peripheral nerve block, or PNB, is a type of regional anesthesia that provides pain relief at specific areas of the body. They are a cornerstone of surgical care and have a lot of advantages. So some of these are, first off, when a PNB is used, there is a reduced need for opioid medications both during and after the surgical procedure. So that's great because, as you know, opioids come with all kinds of risks like oversedation, delayed or prolonged recovery, decreased mobility, and respiratory depression. So if we can avoid using opioids as much as possible, our patients are going to recover faster and overall do better. Another advantage is that there is a reduced need for sedation during surgery, which in a lot of cases enables the anesthesiologist to utilize a type of anesthesia called MAC, M-A-C, which stands for Monitored Anesthesia Care. And in procedures utilizing MAC, the patient is able to breathe on their own and they don't have to be intubated, though sometimes you'll see a laryngeal mask airway or LMA used to maintain airway patency. Note that MAC is not always used when a PNB is utilized, but the use of a peripheral nerve block means MAC is an option for anesthesia. Another advantage is basically avoidance of general anesthesia, which does have systemic effects in patients for whom that might not be the best idea, like pregnant patients or those who are at very high risk for respiratory depression, such as a patient with obstructive sleep apnea or serious pulmonary disease or advanced age. And then also in patients who are fearful of general anesthesia. In a lot of cases, maybe we can use a peripheral nerve block in order to prevent the patient from having to completely go under. Another advantage is decreased incidence of post-op nausea and vomiting, which are often associated with opioid use. Another is better pain management in individuals who, better pain management overall, that's why we use them, but specifically in individuals who wish to avoid systemic medications or who are less responsive to oral medications, such as a patient with a malabsorption disorder or something like that. I've taken care of a patient a few times who's had much of their small bowel removed because of an autoimmune condition, and oral medications don't work well on this individual because of that. Two more advantages are decreased risk for post-op sedation and The use of a peripheral nerve block promotes early ambulation as well as improved recovery times and earlier discharge. So lots and lots of advantages to using a peripheral nerve block. So the next thing you might be wondering is, well, how do peripheral nerve blocks work? So peripheral nerve blocks work by essentially preventing pain stimuli at the location of injury or location of surgery, and we prevent this pain stimuli from reaching the central nervous system. The medication itself is instilled near specific peripheral nerves or nerve plexuses. The block affects nerve fibers in the following order. So first, sensory is affected, then motor, then sympathetic function. However, so that's with the initiation or the onset of the medication. However, as the block is resolving, it resolves in a different order. Motor function returns first, followed by sensory function, then sympathetic function. So this is important to understand as it helps the patient to know what to expect as they are recovering from surgery and helps you know what to expect as you're assessing this patient after surgery or when a PNB is being used. And we'll talk more about nursing considerations a little further on in this episode. Now, the next question you might be asking is, well, when do we use a peripheral nerve block? So peripheral nerve blocks are actually utilized in quite a wide variety of situations. Mainly, it's going to be surgical situations. We'll talk a little bit about some specific types of procedures in just a moment, but I also just want to quickly mention when they are maybe contraindicated or possibly avoided. So first off, let's say you've got a patient who's coming in for knee surgery, for example, but they have an infection at the site where that injection would need to be placed. We're not going to use a peripheral nerve block on that patient anytime there's infection at the site of injection. It could also be avoided or contraindicated in a patient who has a neural deficit in the area where the block would be utilized. And in some cases, a patient who has a coagulopathy may not get a peripheral nerve block because of the risk for bleeding and a hematoma formation, especially with deeper blocks that are injected into areas that would be difficult to compress. You know, if you have bleeding, you use compression to stop the bleeding, but if it's in an area that is essentially non-compressible, then we would probably not want to use it in a patient who's at high risk for bleeding. So again, surgical procedures are probably the most common use of peripheral nerve blocks. They may be utilized during the procedure. They're actually typically started before the surgery begins, so in the pre-op area, and then you may see it done again after surgery to provide post-op pain control. So, for example, knee surgeries, knee replacements, knee arthroscopies, meniscus repairs, etc., could get a femoral nerve block, which is a type of peripheral nerve block. Note that because a femoral nerve block does cause pretty significant quadricep weakness, you may actually see a different type of block utilized called an adductor canal block. And this is similar to a peripheral nerve block. It's actually a type of interfascial plane block that doesn't weaken the quadricep muscle as much as a femoral nerve block does. And the benefit of that is if we use this other type of block, the patient can get out of bed, have earlier ambulation, and faster discharge. But you could also see a femoral nerve block used, which is a type of peripheral nerve block. So for knee surgeries, you could see an axillary block for surgeries of the wrist or hand, such as a carpal tunnel release or a fracture repair. You could see a popliteal block for foot or ankle surgery. And another example is an interscalene block or brachial plexus block for surgeries of the shoulder or the arm. And there are many, many more, but I just wanted you to have kind of an overview and a glimpse at what you might see and how these nerve blocks may be utilized. So the next question you might have about peripheral nerve blocks is, well, how do we actually administer these? So peripheral nerve blocks can be administered in one of two ways. Sometimes it's administered as a single injection. You may hear this called a single shot, or as a continuous or intermittent infusion. So when a continuous or intermittent infusion is utilized, the patient's going to have some kind of catheter in place. It's put in place by the anesthesiologist. It's very similar to an IV catheter, except it's not going into a vessel. And the medication is instilled via a portable pump, tiny little pump, or a pressurized system. So let's talk about the pump first. One example of a portable pump is something called an ambit pump. That's like the brand name of the pump. It's a tiny little pump. I'd say it's about the size of a TV remote control, and it is a battery-powered device that is programmed to deliver either a continuous, steady infusion, or intermittent boluses, or on-demand boluses where the patient pushes a button and it delivers medication, or combinations of these delivery modalities. At my facility where I work, we use these ambit pumps all the time, and off the top of my head, I want to say it delivers an intermittent bolus every 3 hours. Now, in contrast, a pressure-based system does not use a battery-powered pump. Instead, it involves the use of something called an elastomeric pump, which is kind of cool. It actually is a ball. It looks just like a ball. It's a round ball full of medication, and this ball is under pressure, and it's the pressure that delivers the medication. So the delivery modality when using an elastomeric pump depends on which specific pump type is chosen. Options include it delivering just a steady flow at a set rate that's not changed, or a steady flow of medication that can be adjusted. And there's a little flow meter device where you turn a dial and it allows the medication flow rate to change based on the patient's pain level. And then there's also one type that has a combination of this adjustable flow rate with a on-demand bolus that the patient can initiate as needed. In the facility where I work, we used to use these. I loved them. Essentially I loved them because they were faster and easier to set up than the ambit pump, which does take a little bit more time. And the one we used was the type with the flow meter. So we would start it at the set rate and then reevaluate the patient's pain level. And if the pain was still not within goal, we would be able to turn up the flow rate by some prescribed parameter in the physician order. All right, next we're going to talk about the medications used in a peripheral nerve block. Before we do that, let's take a quick minute for a word from our sponsor. When it comes to grocery shopping and meal planning, I've got a little bit of a problem. I'm terrible at meal planning. Instead, I get inspired by recipes I see online, spend a ton of money, and struggle through overly complicated meal prep. But all that's about to change thanks to Hungryroot. Hungryroot is like having your own personal shopper and nutritionist. I just told them about my goals and preferences, and they filled my cart with personalized recommendations. And here's the part I love the most. All of Hungryroot's recipes can be made in just 15 minutes or less. I'm super excited about my upcoming delivery. All the recipes look absolutely delicious, but I'm especially excited to try the zesty cauliflower tacos on almond flour tortillas. Plus, they also have smoothies, ready-to-eat meals, and salad kits. My life just got a whole lot easier. You're going to love Hungryroot as much as I do. Take advantage of this exclusive offer. For a limited time, get 40% off your first box, plus get a free item in every box for life. Go to hungryroot.com/nursemo and use code nursemo. That's hungryroot.com/nursemo, code nursemo to get 40% off your first box and a free item of your choice for life. hungryroot.com/nursemo, code nursemo. When we are using a peripheral nerve block, we're essentially looking at one key type of medication, and that medication is a local anesthetic. Now, as a reminder, local anesthetics block nerve impulses so that pain signals are not going to be transmitted to the brain, and the result is that anesthetized area is essentially it's numb and pain is controlled. A key way to know if a medication is a local anesthetic is that it ends in the suffix caine, C-A-I-N-E. The most common local anesthetics utilized in peripheral nerve blocks are ropivacaine and bupivacaine, though you could see lidocaine utilized when a shorter duration of action is warranted. Ropivacaine and bupivacaine have a much longer duration of action, lidocaine not so much. Now, you could also see some other medications utilized as adjuvants, and these are medications that help boost the performance of the primary medication. So these are going to help the medication act more quickly or prolong the duration of pain control. So some common adjuvants are epinephrine and dexamethasone. Maybe a little less common are sodium bicarbonate and clonidine. So let's first look at epinephrine. So epinephrine is a potent vasoconstrictor, and it is the most common vasoconstrictor utilized with a peripheral nerve block. Its vasoconstricting properties help that local anesthetic remain close to those target nerves. And what this does is it extends the duration of the block. Now, another benefit of epinephrine is it helps prevent the local anesthetic from entering systemic circulation and reduces the risk of systemic toxicity, which we'll talk about in just a moment. Another is dexamethasone. For some types of peripheral nerve blocks, the corticosteroid medication, dexamethasone, can also be utilized to extend the duration of the block's effects. And then sodium bicarbonate, this medication is utilized sometimes to speed up the onset of the peripheral nerve block, and this happens because of complicated chemistry things, which we don't need to go into here. Just know that if it is used, it's essentially being used so that the onset is much quicker. And then clonidine is an alpha-2 agonist, and it has been shown to prolong the duration of peripheral nerve blocks, but it comes with some side effects. It comes with increased sedation, hypotension, and bradycardia. So for that reason, I don't really see this used. Mostly I see epinephrine being used. Now, speaking of side effects, let's talk a little bit about peripheral nerve block complications. So one of those is infection. And I will say that serious adverse effects are not common, but they can occur. So infection. Any invasive procedure can cause infection, right? You know this. Now, the risk of that is going to be higher when the patient has that indwelling catheter versus if they just get that single shot bolus injection. Another potential complication is pneumothorax. This can occur when the injection is near the lung, such as in a supraclavicular block, so up by the clavicle. And then a combination or grouping of adverse effects include a hoarse voice, a drooping eyelid, vision changes, unequal pupils, even facial drooping, and mild shortness of breath. These can occur when the injection is placed near the neck, and symptoms should resolve as that block subsides. Another complication is nerve damage. Now, while permanent nerve damage is an uncommon complication, some patients can have extended numbness that can last for up to 6 weeks, even up to a year following the procedure. And then bleeding or hematoma formation, that's another complication. Vascular damage can lead to bleeding. It can lead to the development of a hematoma, which is a collection of blood inside the body. This is more likely in patients who are taking anticoagulants, and again, is most troublesome when the area is non-compressible, such as with a deeply placed block. And then the last complication I'll mention briefly is local anesthetic systemic toxicity, which goes by the short name LAST. So this complication can occur when local anesthetics extend into the system at toxic levels. Now, this is most typically due to the medication inadvertently being administered into the vascular space, but it can also be due to overdose of local anesthetic itself. I have got a whole episode about local anesthetic systemic toxicity, so if you'd like to learn more about this complication, you want to head over to episode 336 and check that one out. Two more things I want to cover with you in this episode are the important nursing considerations for peripheral nerve blocks and the key things you want to teach your patient. So let's talk about nursing considerations. Though peripheral nerve blocks are highly effective at managing pain and come with that impressive list of benefits that I talked about earlier, they do still require thorough nursing assessment and appropriate interventions to spot and avoid complications. So first, let's talk about patient safety. When a limb, an extremity, an arm or leg or whatever, is unable to feel sensation and or unable to move, this puts the patient at higher risk for injury. So for example, let's say you've got a patient with a peripheral nerve block on the arm. They're going to be wearing an arm sling the entire duration that block is in effect because they're not going to be able to feel their arm, may not even really know where their arm is in space, super high risk for injury. So they're going to wear an arm sling to keep the arm close into the body. This protects the limb from inadvertent injury and supports its position until that medication wears off. Let's say you've got a patient who had a block of a lower extremity. Your biggest patient safety concern here is a fall, right? They're at super high risk for falling. So you'd want to make sure the patient has both adequate sensation and strength before attempting to get that patient out of bed. Another key nursing consideration is to monitor your patient for complications. As with any medication or invasive procedure, it's really important to monitor for complications, and I mentioned some of those above. One of those was local anesthetic systemic toxicity. Again, you can go and listen to episode 336 for a deep dive into this concept, but some early symptoms I do want you to know about include confusion, tinnitus, which is ringing in the ears, a metallic taste in the mouth, and numbness and tingling around the mouth. Those are some early signs. Signs of pneumothorax, which would be another very serious complication, include shortness of breath, tachypnea, and decreased oxygen saturation levels, as well as diminished lung sounds on that side. Should you suspect any serious complication for your patient, you're going to alert the anesthesiologist immediately. You also want to monitor for nerve trauma. If the patient's experiencing very sharp pain, especially while that anesthetic is being delivered, let's say they've got an ambient pump, and whenever it does that intermittent infusion, they complain of sharp pain, that could be a sign of nerve trauma. You want to let the anesthesiologist know right away. And of course, pain assessment. You will be assessing your patient's pain level, the quality of the pain routinely throughout the use of a peripheral nerve block to basically ensure that it's working as anticipated. In some cases, let's say it's not providing adequate pain coverage, you could reach out to the anesthesiologist, and depending on how much local anesthetic they've already received and are currently receiving, they could be a candidate for an additional bolus injection. Of course, we always want to keep in mind that last or local anesthetic systemic toxicity can occur. So it might be the case that the anesthesiologist says, can't really give them any more local anesthetic. So in that case, you could supplement the peripheral nerve block with another analgesic medication such as acetaminophen, an NSAID like ketorolac, or even an opioid if needed. You're also going to test the patient's sensation. This is monitoring the patient for numbness and tingling or paresthesia, and you just do that using light touch and asking the patient, do you feel any numbness or tingling in your legs and feet or arm or hand or wherever that block is affecting their body? With that, we're also assessing motor function. You're going to monitor for resolution of that blockage of motor function by asking your patient, can you move whatever affected body part that it is? Now remember, as the block is resolving, motor function returns before sensory function. This can kind of give you a heads up that additional pain management modalities may soon be needed, because if motor function's coming back, then that means sensory function follows. The timeline on that can vary from patient to patient, but just be aware of it. It's also really important to assess for muscle strength and mobility before assisting the patient out of bed when that lower extremity is affected by a peripheral nerve block. Remember, patient safety is a high priority. Alrighty, so now we're to the final section of this episode. We're going to talk about some key patient education. Patient education regarding a peripheral nerve block is really important due to the safety factors involved and the fact that many times patients go home with an infusion pump for prolonged therapy or go home while the effects of the block are still occurring. So here are some key things to include. First off, let's let the patient know how long they can expect this block to last. Now, how long a nerve block lasts depends on the medication used and the type of block performed, like what nerves were affected. In the case of a single shot injection, pain control can last up to 12 or 24 hours. And then with an infusion pump, the pain medication is delivered either continuously or again in those intermittent boluses, and that usually is for a period of 2 to 3 days. Now, if you're not sure how long the block is expected to last, this is a fabulous question for the anesthesiologist. And the reason I like to know this is because if pain sensation returns sooner than expected, this is a sign that the block has not been fully effective and additional intervention may be needed. And then if it's also not resolving when I expect it to, this is a sign that the patient may need further evaluation by the anesthesiologist. All right, the patient may also want to know about how the block is administered. So teach the patient that administering the injection or placing that catheter takes 5 to 10, maybe 15 minutes, and it's usually done under ultrasound guidance to ensure the most accurate placement possible and hopefully avoid injecting that local anesthetic into a vessel where it gets into systemic circulation. And then the onset is another thing to share with your patient. Teach them that it doesn't really take effect immediately. It's going to have full effect in 15 to 20 minutes or so. And then you also want to share safety information with your patient. Ensure they understand all the safety parameters and how to avoid injury while that area is numb. So example is that arm sling I talked about earlier. They should be taught to wear that arm sling all the time until they recover full sensation and movement of that affected arm. They should also be very careful with hot or cold temperatures on the affected body part since they won't be able to feel either and tissue damage can occur. Now with that, let's also teach them how to avoid pressure injury. So you might want to say, hey Bob, you need to periodically reposition yourself to avoid pressure injury. Like let's say they have a peripheral nerve block on their leg. You're going to teach him every hour or every 2 hours, reposition the leg, change the location of the pillows, whatever it might be to reduce the risk of pressure injury. For arms, you can also teach the patient that sleeping in a recliner with that arm supported on a pillow is helpful to avoid accidentally, entrapping the limb, rolling over on it, causing injury of some kind. All right, what if your patient goes home with one of those cool infusion pumps? Really great thing about these infusion pumps is that they come with a cute little bag. It's like a little purse. So teach your patient to keep all their stuff in that little bag to prevent you don't want the tubing to get all tangled and kinked because that could cause problems. It could snag on things. This could cause the catheter to become dislodged. It could cause disconnection. So let's make sure the patient knows to keep their little infusion pump in its bag at all times, and that if they notice any leaking or if it's not working, that they know how to reach out for help with that. And we'll usually have a phone number for the patient to call. Along with that, you would want to teach them if they see any signs of infection at that site. That would be a reason to call for some help as well. And then you also want to teach the patient what to expect. Teach the patient that feelings of numbness, heaviness, tingling, weakness, and inability to move the extremity are normal effects of the block. It's a weird sensation and it can be troubling. Make sure the patient knows these are normal. And then speaking of some side effects, you also want to teach the patient, especially with interscalene and supraclavicular blocks, that they could experience a hoarse voice, unequal pupils, blurred vision, even drooping on one side of the face or shortness of breath. These symptoms should resolve once the block wears off. And again, when to call the physician. Ensure the patient understands that Certain situations warrant a phone call. This includes the block lasting longer than expected, so prolonged block effects, significant or prolonged shortness of breath, pain that is not controlled by the block or supplemental pain medication, and any other sign of a potential complication, such as infection or hematoma or any issues with their pump. So there you have it, your hopefully quick overview of peripheral nerve blocks. I think I've been talking for about half an hour now, so that's relatively quick. Your too long, didn't read summary is this. Peripheral nerve blocks are regional anesthesia techniques that provide targeted pain relief for various surgeries by injecting local anesthetic near specific nerves or nerve plexuses. Local anesthetics used include ropivacaine and bupivacaine, while adjuvants such as dexamethasone and epinephrine enhance efficacy. Nursing priorities include monitoring for complications, assessing pain, and evaluating both sensory and motor function while keeping a close eye on patient safety. Two key benefits of peripheral nerve blocks are that they reduce systemic analgesic use and shorten recovery times. Thank you so much for spending your free time or commute time or folding the laundry time or walking the dog time with me today. As always, I really treasure this time we have together, and I look forward to speaking with you again soon. Bye for now. This podcast is brought to you by Straight A Nursing, a proud member of the Airwave Media Network. For more educational podcasts, check out airwavemedia.com. And for more nursing-related content, go to straightanursingstudent.com.
Do you find it hard to sleep at night? Then the Calm Cove podcast can help you sleep deeply all night long. Calm Cove has deeply relaxing meditation music and ambient sounds like ocean waves and crackling fires. All of our episodes are designed to help you relax and to fall asleep fast. Calm Cove is brought to you by the team behind Sleep Cove, the sleep podcast that consists of spoken word hypnosis, meditation, and stories. So if you want to listen to a beautiful soundscape tonight, search for Calm Cove on Apple Podcasts or Spotify and see how we're helping millions of people relax and go to sleep every night.